Let's talk a little bit about those things that we hope to accomplish today with this co-discovery process. You know, one of my goals is anytime we want to help dentists, I want to help them be more successful. And part of that, maybe an appropriate title for this segment is improving case acceptance, although that's not really what it's about, but that is an outcome, I think, of great co-discovery.
Yeah. I think there's a great patient outcome as well. It is about helping dentists, but it's also about helping patients choose health for themselves, which is, I think, an admirable outcome.
Serves everybody well.
Absolutely.
Yeah. So as we think about the process, we're going to show two vignettes. One is Mary doing a preclinical conversation with Tony, and then I'll do a clinical exam, and then the other is Mary doing a preclinical conversation with Yami, and Lee, you'll take that to the clinical exam. What is it we want people to be thinking about, and maybe how would you guide people to view this video that we're going to do? What suggestions would you have for them?
Well, for me, I would ask people to think about possibilities, because I think that if just viewed as a clinical exam, probably most of the dentists watching this would know how to do a clinical exam already. That's not going to be new. What I think is different is the opportunities that are presented through this type of an exam. I think in dental school you learn to do an exam as a data gathering process. And then maybe at some point you begin to see the exam as an educational process. Well, I think there's even more that's possible through the exam. And so I would say for the people watching it to begin to see it as sort of a what if. How would our practice be different if we did slow down the pace a bit during the examination, if we weren't quite as efficient as we've been taught to be, and if we did engage the patient more in the process? How, for example, would your consultation appointments go, your treatment conferences go, if the patient were this actively involved in the exam? And I find a lot of times in dentistry, the focus tends to be on how do we present the case. And I believe this part of the process, the exam part of the process, goes a long way to moving that part of the process forward. And if we do this in a more intentional way, then we're that much more successful when we get to the consultation appointment, because the patient is already much farther down the line.
I would agree, Mary. Whether it's for the dentist or if there are team members watching this, the way I always think about it is, you know, how would this type of an examination, creating this type of patient engagement, change our experience of dentistry? Not only how much we enjoy our time in the dental office as the dentist or the team member, our case acceptance, having our patients be actively involved. How will that change the type of dentistry we get to do? Will we get to do more of the dentistry? That's our goal as a team, that we just love to do. Will we get to do it with patients who we enjoy spending time with more because we know them and we're in this all together as partners? And how will even just that process of dentistry, if they can think down the line around what it would be like to work with Tony and Yami on some of the dentistry that they're already going to be able to imagine for themselves watching this, that would be the ultimate treatment plan. What would it be like to partner with them to complete that, given how well we've started the relationship?
And how much more appreciative the patients are when they have played an active role all the way through the process. You know, I always say in dentistry, we don't want people to just do the dentistry. You don't want them to just pay for it. We really like it when they bring us brownies.
Yeah.
You know, those are always the favorite patients. They're the ones who really appreciate what we've done for them. And that is really my experience of what comes out of this kind of a process, is a much deeper appreciation for the work that we're doing for people and the results that we get.
Yeah.
Absolutely. And then how do those patients, those appreciative patients, talk about who we are as a team to other potential patients? How do they help us grow our practice in the direction that we'd like it to go?